Imagine reaching for a handful of a healthy-looking nut mix, only to discover one bite could increase your risk of liver damage by a staggering 48%. In the next 3 minutes, you'll learn exactly which nut to avoid and 4 incredible powerhouses that actively protect your heart, bones, and brain. This isn't speculation. That 48% figure comes from a 20-year study published in the prestigious journal of the American College of Cardiology. Stay with me until the 3-minute mark, and I'll reveal the toxic nut lurking in most pantries. I'm about to give you the complete guide, the 4 powerhouse nuts that can safeguard your brain, fortify your bones, and strengthen your heart. Plus, I'll expose the 4 dangerous nuts you absolutely must limit or avoid entirely when making snack choices that could change your health forever. If you believe all nuts are created equal, you're not alone. But you might be dangerously misinformed. Many seniors instinctively reach for nuts over processed snacks, and while that impulse is correct, the reality is far more complex than most realize. The wrong nuts can ignite inflammation, destabilize blood sugar, and even interfere with vital medications. This isn't about eliminating nuts. It's about understanding which ones actively support your aging body and which ones are silently working against your health goals, day in and day out. Tap like now so more seniors see this crucial information. This knowledge could literally transform how you approach nutrition and empower you to maintain your independence for years to come. Type NutSmart in the comments if you're ready to discover which 4 nuts truly deserve a place in your daily routine, and which 4 should be strictly limited or avoided to protect your heart, brain, and metabolic health. Here's what most people don't grasp about nuts and aging. They're not just simple snacks. They're concentrated packages of compounds that can either fight the aging process or accelerate it. Groundbreaking research from Harvard shows that seniors who choose the right nuts experience clearer thinking, stronger bones, and more resilient hearts. Yet, few seniors are aware of this hidden opportunity. The compounds in certain nuts can powerfully cross the blood-brain barrier, offering direct protection against cognitive decline. They deliver essential minerals that actively prevent bone loss and provide healthy fats that keep your arteries flexible and strong. But beware. Other nuts contain hidden carbohydrates that spike blood sugar, harbor toxins that stress your liver, and carry inflammatory compounds that worsen joint pain and cardiovascular problems. This is why random nut consumption can be utterly counterproductive for seniors. As your body navigates the natural changes of aging, every nutritional choice becomes critically important. The solution isn't to avoid nuts. It's to understand precisely which ones support your unique health needs and which ones could be undermining your efforts to remain healthy and independent. Good nut number 1. Almonds, your bone, artery, and cellular protector. Here's why almonds deserve the top spot in your daily routine. Almonds have rightfully earned their reputation as one of the most complete plant-based foods, especially for older adults who need robust bones, clear arteries, and powerful cellular protection. Each 1-ounce serving delivers approximately 97 milligrams of calcium. That's roughly the same as a quarter cup of milk. This is incredibly significant for anyone facing thinning bones or striving to maintain bone density as they age. But calcium alone isn't what sets almonds apart. They also contain magnesium, a mineral crucial for calcium absorption, ensuring it reaches your bones instead of accumulating in soft tissues or arteries. This calcium-magnesium synergy supports skeletal strength without elevating cardiovascular risk, according to the National Osteoporosis Foundation. What makes almonds even more valuable for seniors is their antioxidant prowess. Their skins contain flavonoids that, when combined with vitamin E, form a formidable antioxidant shield. This powerful combination helps reduce oxidative stress, a process directly linked to cellular aging, memory loss, and weakened immune function. The vitamin E in almonds also supports skin health and may help preserve memory function as we age. For powerful cardiovascular support, almonds provide around 9 grams of heart-healthy monounsaturated fats per ounce. These fats actively help reduce harmful LDL cholesterol while boosting beneficial HDL cholesterol, maintaining healthy arteries and improving overall heart function. They also offer about 3.5 grams of dietary fiber per serving, contributing to digestive regularity and enhanced cholesterol control. Good nut number 2. Walnuts, the brain-saving powerhouse. Here's why walnuts are truly considered the ultimate brain-saver nut. Few foods so obviously resemble the organ they protect as walnuts do. Their distinctive brain-like shape is a clear hint at their most profound benefit for seniors. A single ounce of walnuts delivers about 2.5 grams of alpha-linolenic acid, ALA, a vital type of omega-3 fatty acid. This ALA plays an essential role in maintaining the structure and flexibility of brain cell membranes. For seniors, these fats are exceptionally valuable because they support crucial signal transmission between neurons and actively protect against age-related neurological deterioration. Research from Tufts University indicates that the omega-3 content in walnuts can help maintain cognitive flexibility and processing speed in older adults. Walnuts are also rich in polyphenol and vitamin E, two compounds with potent antioxidant properties. Unlike many antioxidants, the polyphenol found in walnuts can cross the blood-brain barrier, allowing them to directly reduce inflammation within neural tissue. This is critical because chronic, low-grade inflammation is now recognized as one of the primary drivers behind conditions like Alzheimer's disease and broader cognitive decline. Walnuts even provide a small amount of melatonin, the hormone that helps regulate sleep-wake cycles, offering a natural benefit for older adults who often struggle with disrupted sleep, a common concern that impacts both mental sharpness and overall well-being. If you found this information helpful so far, please tap that like button to help others discover it. Your engagement helps this vital content reach more seniors who need to understand these crucial nutritional choices. In just 60 seconds, you'll meet the blood pressure balancing nut that most snackers completely overlook, plus I'll reveal a mineral powerhouse that demands strict portion control to avoid toxicity. Good nut number 3, pistachios, your heart's pressure balancer. These small green nuts may appear modest, but their benefits for older adults are truly substantial. A 1-ounce serving offers a perfectly balanced mix of plant-based protein, healthy fats, and powerful antioxidants, all while remaining relatively low in calories at approximately 160 per ounce. What makes pistachios particularly invaluable for seniors is their remarkably high potassium content, around 285 milligrams per serving. This superior potassium-to-sodium ratio actively helps neutralize the blood pressure-raising effects of sodium, making them especially beneficial for older adults managing hypertension. Clinical studies published in the American Journal of Clinical Nutrition show something remarkable. Pistachio consumption has been associated with meaningful reductions in systolic blood pressure. Beyond cardiovascular benefits, pistachios offer unique advantages for blood sugar regulation. They boast a low glycemic index and contain an optimal blend of protein, fiber, and healthy fats. This combination effectively slows the absorption of carbohydrates when eaten with meals, preventing post-meal blood sugar spikes. This makes them an exceptionally smart choice for the significant number of seniors managing type 2 diabetes or insulin resistance. Pistachios also support vision and brain health through their concentration of lutein and zeaxanthin, carotenoids that protect the macula and may help reduce the risk of age-related macular degeneration, the leading cause of vision loss in seniors. Emerging research even suggests these compounds may play a role in maintaining mental acuity later in life. Good nut number 4, Brazil nuts, the thyroid and immunity booster requiring careful dosing. Brazil nuts offer something no other nut can provide for seniors, an extremely concentrated source of selenium. This vital trace mineral plays essential roles in thyroid hormone activation, robust immune function, powerful antioxidant defense, and crucial cognitive protection. Just one large Brazil nut contains around 96 micrograms of selenium, surpassing the daily recommended intake for most older adults. This makes them less of a casual snack and more of a potent therapeutic supplement, wrapped in a natural shell. Selenium is absolutely required for converting the thyroid hormone T4 into its active form, T3, which regulates metabolism, energy production, and mood. Quick note, if you take thyroid, blood pressure, or statin medication, always discuss your nut choices with your doctor. Thyroid issues significantly rise after 60, especially for postmenopausal women, and overlapping symptoms like fatigue, weight gain, and forgetfulness mean it's often misdiagnosed. Regularly including Brazil nuts, but in strict moderation, may help support better hormone balance. Beyond thyroid benefits, Brazil nuts contribute to neurological resilience. Selenium is directly involved in protecting neurons from oxidative stress, and low selenium levels have been associated with increased cognitive decline. Several studies suggest that improving selenium status may support clearer thinking, better memory, and mood stability in aging adults. However, Brazil nuts demand extreme caution. The very selenium content that makes them so powerful can also make them risky in excess. More than 2 Brazil nuts in a day can quickly push you toward selenium toxicity, causing symptoms ranging from fatigue and gastrointestinal upset to brittle nails, hair loss, or even nerve dysfunction. For most people, just one Brazil nut daily is sufficient. Stick to one Brazil nut a day, and only 2 on very rare occasions. Enjoy the 4 good nuts daily. The 4 nuts to limit or avoid. Now, let's turn our attention to the 4 nuts you absolutely must limit or avoid. Stay with me, because understanding these could be even more important than knowing which ones to include. These next insights about hidden toxins, blood sugar spikes, and medication interactions could prevent serious health problems that most seniors never see coming. We need to discuss the 4 nuts that could be quietly sabotaging your health efforts. These aren't necessarily evil foods, but for seniors dealing with specific health challenges or taking multiple medications, these nuts come with serious risks that often outweigh their potential benefits. Limit nut number 1. Peanuts, the hidden liver risk. Peanuts may be one of the most common snack foods worldwide, but for older adults, they carry health risks that are frequently underestimated. Unlike true tree nuts, peanuts are legumes that grow underground, making them particularly susceptible to contamination by molds that produce aflatoxins. Aflatoxins are potent carcinogens that can damage liver cells over time. Even low-level chronic exposure has been linked to liver problems and impaired immune function. Seniors are more vulnerable to this hidden threat, especially those with weakened liver function or compromised detoxification systems, according to research from the American Liver Foundation. Peanuts are also a major source of omega-6 fatty acids. While omega-6 isn't harmful by itself, an imbalance between omega-6 and omega-3 fatty acids actively promotes systemic inflammation, a condition tied to arthritis, heart disease, and cognitive decline. Most older adults already consume too much omega-6 from processed foods. Peanuts simply add to this inflammatory burden. Limit nut number 2. Cashews, the hidden blood sugar spiker. Unlike most tree nuts, cashews are surprisingly high in carbohydrates. They deliver approximately 9 grams of total carbs per ounce, with only about 1 gram of fiber. This elevated net carb load can spike blood sugar more quickly than other nuts, a dangerous feature for seniors managing prediabetes or diabetes. Beyond their glycemic impact, cashews present risks through their oxalate content. Oxalates are naturally occurring compounds that can bind with calcium in the digestive tract, leading to kidney stone formation in susceptible individuals. For seniors with diminished kidney function or a history of urinary stones, cashews can quietly exacerbate existing risks. Limit nut number 3. Macadamia nuts, the calorie bomb that stresses your system. While they may feel luxurious, for seniors, macadamia nuts often pose more drawbacks than benefits. One of the biggest concerns is their extreme caloric density. Just 10 to 12 macadamia nuts can pack around 200 calories, primarily from fat, yet they provide minimal protein or fiber to create satiety. What truly sets macadamias apart is their unusually high saturated fat content among commonly consumed nuts, nearly 3 to 4 grams per ounce. Excessive intake could contribute to rising LDL cholesterol, potentially worsening existing cardiovascular conditions for seniors already managing heart health or taking medications like statins. Their rich, fatty nature also places stress on the gallbladder, a concern for those with known or silent gallstones, a condition that increases with age. Macadamias can trigger digestive flare-ups, nausea, abdominal pain, or even gallbladder attacks, especially if eaten in larger portions. Limit nut number 4. Pine nuts, the medication-interfering aspiration hazard. Despite their gourmet appeal, pine nuts come with several concerning drawbacks for older adults. One of the most peculiar effects is pine mouth syndrome. Within 1 to 3 days after consumption, some individuals develop a persistent metallic or bitter taste that can last for days or weeks. While not physically harmful, this effect can suppress appetite and cause unintentional weight loss in seniors, a group already prone to undernourishment. More seriously, pine nuts contain compounds that may interfere with common medications, including blood pressure drugs, antidepressants, and cholesterol-lowering medications. These interactions aren't widely documented in mainstream guidelines, making them particularly dangerous for seniors managing multiple prescriptions. Pine nuts also present a distinct aspiration hazard due to their small size and slippery texture. They're one of the easiest nuts to accidentally inhale, especially among seniors with swallowing difficulties or dry mouth from medications. If aspirated, these tiny nuts can block airways or lodge in lungs, potentially leading to aspiration pneumonia, a serious condition in the elderly. Practical implementation: your Sunday nut audit. Here's how to implement this knowledge effectively. 1. Stock smart. Prioritize almonds, walnuts, pistachios, and one Brazil nut for daily consumption. 2. Portion control. Always serve nuts in a small ramekin. Never eat directly from the bag. This prevents overconsumption. 3. Treat, don't staple. Keep peanuts, cashews, macadamia nuts, and pine nuts reserved for occasional treats, not daily snacks. 4. Proper storage. Store high-fat nuts like walnuts and Brazil nuts in the refrigerator to prevent rancidity. Rancid fats can turn beneficial compounds into harmful ones. 5. Brazil nut rule. For Brazil nuts specifically, limit yourself to 1 per day, with a maximum of 2 on rare occasions. More than this can lead to selenium toxicity. Research from the American Heart Association shows something truly encouraging. Seniors who follow structured nutritional guidelines like these demonstrate better cardiovascular outcomes, more stable blood sugar, and improved cognitive function compared to those making random food choices. The key is consistency, not perfection. Consider discussing your nut choices with your healthcare provider, especially if you take medications for blood pressure, diabetes, or thyroid conditions. Some nuts can enhance or interfere with medication effectiveness. Your doctor can help you optimize both your nutrition and your treatment plan. While knowing which nuts to choose and avoid is crucial for protecting your health, remember that your overall dietary pattern remains your most powerful tool for healthy aging. Work with your healthcare provider to create a comprehensive nutrition plan that includes appropriate nuts alongside other foods supporting bone health, cardiovascular function, and cognitive performance. Monitor your blood pressure, blood sugar, and cholesterol levels regularly to see how dietary changes affect your biomarkers. Pay close attention to your energy levels, sleep quality, and mental clarity. These serve as valuable indicators of how well your nutritional choices are supporting your overall health. Today's snack can either build strength for your golden years or quietly undo decades of hard work. The choice is truly in your bowl. Nuts are powerful foods that can either support or undermine your health goals, depending entirely on which ones you choose and how you consume them. The difference between thriving in your later years and struggling with preventable health problems often comes down to making informed choices about seemingly simple decisions, like which nuts to keep in your kitchen. You now have the knowledge to select nuts that actively support your cardiovascular health, cognitive function, and overall well-being. You also understand which ones to avoid or limit strictly. This information could help you maintain your independence and vitality for years to come. Type yes if today's tips helped you. Click subscribe and turn on notifications so the next senior-friendly guide finds you. Share this vital information with your adult children, grandchildren, neighbors, or friends who want to make informed food choices as they age. Your recommendation might be the guidance that helps them avoid nutritional mistakes and build stronger health for their future. Stay prepared, stay informed, and keep making choices that support the vibrant, independent life you deserve. Remember, this information is educational and should never replace personalized medical advice from qualified healthcare professionals who understand your unique health circumstances.